Hey everyone, this is Hannah with the Rocket Miner. Today I wanted to talk to you a little bit about the COVID-19 vaccine. First I want to go over some of where we're at with COVID in Wyoming and in Sweetwater County, and then share with you some of my experiences and my thoughts regarding the vaccine. So first, as an update, I just wanted to go over the numbers really quickly. For Wyoming, as of today, we have had 56,619 total confirmed and probable COVID cases. We have had 55,520 total recoveries. Today we got another update on the death total. So Wyoming has had 701 total deaths. That was one death that was added this week. Last week we reached that 700 mark exactly. So that's where we're at to date with how many deaths we've had. And then as of today, for the whole state of Wyoming, we have 398 active cases. We had been staying below 500 for the past couple weeks, but still over 400. In the past week, we did go down below 400 for the first time in forever. It did go up again by 50 today, so that put us at the 398. So right there, close to 400, but still underneath it. So that's good. Hopefully that will continue to go down in the coming weeks. As far as Sweetwater County goes, right now we're right around 45 active cases or so. We did have the bi-monthly COVID-19 update meeting yesterday with local health officials. So our county health officer, Dr. Jean Station, gave an update on some of where we're at. She said right now we're at a 5.7% positivity rate, and that's good. That's way better than we were doing for a while there. And it's almost down to that target range of being below 4%. So we are doing good as far as that goes and not having too many active cases at the moment. Unfortunately, we're still not doing great as a county, especially compared to other counties through Wyoming. We are one of the 4 counties that is still in the red zone with high transmission levels. So we're still getting lots of new cases. Thankfully, people are recovering, which is kind of balancing out with that active case number, but we are still getting lots of new cases, which is that high transmission level. Dr. Station also reported that Sweetwater County is one of 12 counties in Wyoming that has had confirmed cases of variants of the SARS-CoV-2 virus. So those variants are when the virus mutates just a little bit, makes it a little bit different. Most of the time, if somebody gets that, the symptoms are the same. It just looks like COVID-19. It is COVID-19. It's just the different variant of the virus. And that affects things like how transmissible it is. Lots of the variants are more transmissible, so it's easier to spread it to other people. So for Sweetwater County, we've had confirmed cases of the B1427 and B1429 variants. Those are classified as variants of concern. So you can look up information about that. The CDC has lots of good information. The Wyoming Department of Health just shared some more information about the variants that have been confirmed in Wyoming. They have those different classes like variants of concern. We haven't had any that are more concerning than that, but again, that just means that they affect things like being more transmissible. Sometimes it affects how it's treated and how effective that treatment is for it. So it's just something to keep in mind and something to be aware of, that we have these variants, and that does affect how it will continue to spread through our community, and how we need to continue to do as much as we can to protect against that. During that update meeting yesterday, it was also estimated that for Sweetwater County, right now we're probably at about 35% herd immunity. That's good that we're up that high so far, but the goal for effective herd immunity is 75%. So obviously we still have quite a ways to go if we're going to reach that. In Wyoming and in Sweetwater County, the vaccine is available to any adults who want it. There's no more groups, and I talked about that the last time I made a video, that anyone who's over 16 for Pfizer or over 18 for Moderna and Johnson & Johnson is able to get the vaccine. But during the update meeting, our health officials from public health and things talked about how we're starting to see a decline in Sweetwater County of the demand for the vaccine. So they've been doing these mass clinics and filling up appointments with as many vaccine doses as we get. They've been able to get those out right away. But things are starting to slow down. We're starting to see less people who actually want to get the vaccine and less people filling up those appointments. And the less people continue to get the vaccine, the harder it's going to be to ultimately reach that herd immunity goal. So thinking of that, wanting to encourage people to get the vaccine, I just wanted to share some of my personal experiences and some of my thoughts and opinions about that, and hopefully give some information, maybe clear up some things just from a little bit that I know. So I am fully vaccinated now, which I'm very excited about. I got my first dose of the Pfizer vaccine on March 11th and my second dose on March 31st. So that was almost 1 week ago now. So I'm about 1 week out from that full immunity, being 2 weeks out from your second dose. As far as my reactions to the vaccine, getting it, I was fine. I did really well, thankfully, didn't get really sick like some people have. With the first dose, I got a sore arm for maybe the next day. Like that night, it started to get pretty sore, and it was a little sore the next day, but really wasn't too bad. I was able to just go about my day like normal. After the second dose, I had heard lots of people saying that, you're more likely to actually get sick and have more of a response after the second dose. So I was kind of mentally preparing for that, but actually did not get as sick as I expected to. Really didn't get sick at all. I had a sore arm again. It was maybe more sore than it was the first time. For the next couple of days after that, I felt kind of tired, maybe had a little bit of a headache, but really overall was pretty much fine. Lots of people close to me and my family and friends have gotten the vaccine and got it right around the same time that I did. So I was curious to see how different people would respond to it. Most of the people I know had a similar response to me, where maybe their arm got sore. One friend felt a little bit nauseous after both the first and second doses, and her arm was really sore, but that was about as far as her symptoms went. One family member I have did get very sick the next day after her second dose. She was nauseous in the night. She had really bad chills for a little bit. The next day had a bad headache and just body aches, and was feeling pretty miserable for that day after her second dose. But then by the next day after that, she was feeling pretty much fine and back to normal. So that was the most drastic response to the vaccine that I've seen of the people that I'm close to. I've heard other people talk about getting sick or having symptoms like that or feeling pretty miserable for the next day. But it's usually no more than a day, maybe 2 at the most, and that's rare that I've even heard of people having a response for that long. So personally, yeah, sore arm was about the worst of it and really felt pretty much fine. And most of the people I know had a really similar response. Talking to people I know who have gotten the vaccine and our decision to get the vaccine, had a lot of conversations of how we agreed that whatever response we had to the vaccine, even if we got sick the next day, we all agreed that that was worth it and definitely better than getting COVID itself or risking the chance of getting COVID. I've known people who got the vaccine who have already had COVID, but there is the chance that you can get reinfected with COVID again. The immunity you get from the vaccine is actually a lot more sure than the immunity that you get from having COVID. So, and I've heard a lot of people say that getting COVID a second time, you actually get more sick in lots of cases. People have seen cases where that's happened. So for us, it was better to get the vaccine and deal with having a sore arm or feeling sick for a day. That's way better than getting COVID and not knowing how your body's going to respond to it. Everyone responds differently. Some people get way more sick than others, and obviously the underlying health conditions affect that, but it's really, there's no way to know how COVID's going to affect you, and we're still finding out so much about long-term effects of COVID, even in people who are young and healthy, and ways that it's impacting them months after the fact. So for us, it was definitely worth the risk. Any risk that we thought was associated with the vaccine was definitely better than risking COVID itself. But talking to people and listening to people, I know that there is a lot of concern about the vaccine, there's a lot of confusion, and honestly there's a lot of misinformation about it out there. I can't address everything. I'm not a scientist or a doctor. I can't answer all the questions in detail. But just from the research that I've done, the things I've read and people I've listened to, has been enough to reassure me of the vaccine's safety and efficiency and the need for it. And I just want to try to address some of the main concerns about the vaccine in what is going to be a very overview sort of way. But people talk about their concern that the vaccine was rushed, or like that they cut corners to kind of push it out there quickly. It really wasn't rushed, it was just focused on, and it happened a lot faster than most vaccines can, but that's because they were giving it the time and the energy and the money and the resources that they needed to develop it as quickly as possible, and because you need to be able to do trials, and they had such a big group of people who had COVID or were experiencing it or around it, so they were able to do the trials more quickly and efficiently with more people than in most cases with a virus or a disease. People talk about the technology being new. It's true that the technology used in the vaccine hasn't been used in mainstream vaccines before, but the technology is not brand new. They've been developing it for close to 20 years. It's very well researched and understood and studied out. It's not just experimental. People talk about how the vaccine is not FDA approved. That's, as far as I understand it, just because it doesn't have that official title. It's like a stamp that you put on something that says it's approved. There's a big process to get to that point, but that doesn't mean that the FDA doesn't support the vaccine. They have studied it and cleared it and condoned it and said that it's safe and efficient and good to use. So technically, you can say that it's not FDA approved. That doesn't mean the FDA doesn't approve of its use. Also, with the vaccine, it's not a live virus, and it's not even a dead virus. So the vaccine does not give you COVID, and it can't give you COVID. That's literally impossible. As I said, people have a reaction sometimes, and those symptoms can be similar to COVID, but it's not COVID itself. It's your body's immune response, and it understanding and getting used to the vaccine. It's not possible for you to actually get the virus or the disease from the vaccine. Also, there are things going around like concerns that the vaccine will make you infertile, things connected to that. Those have been pretty soundly disproven multiple times. So I understand that there are concerns and there are questions and there are things people want to understand about the vaccine. Those are just some of the main objections to it that I've heard. But I just really encourage people to do research and look into things and look into multiple sources. If you've heard an argument about the vaccine and problems that it could cause, specifically look and see if you can find an argument that disproves that concern, especially if you can find multiple sources disproving that concern. Do look into multiple sources from different people in different places. Make sure that the sources you're looking at are reliable. Do research into where that's coming from and who's saying it. I really do encourage people to listen to scientists and healthcare providers. They're the ones who understand all the details of how the vaccine works that I can't even begin to comprehend because I'm not a scientist. But they understand it, they can explain it. Usually they do a good job of explaining it in a more simplified way that's easier for people like me to understand. But they do know what they're talking about, and we can listen to and trust them. And also, I just personally, I don't believe that the vaccine is a conspiracy. It's being used all over the world. It's been given to millions of people now. If there were massive problems, we would know about it by now. I don't believe that there's an agenda here from the companies who are putting out the vaccine, or from the people who are giving it out, or from the government. I really think that it is just to save people's lives and to stop this disease and to reach that level of herd immunity and protection without having to sacrifice countless lives by just letting the disease run rampant. I do understand that getting the vaccine is a personal choice. I am not going to stand here and say everyone should get the vaccine, because I don't believe that. I do think it's personal. I do think that some people have valid reasons for not getting it, especially if they have had allergic reactions to vaccines in the past, situations like that. But I think that for the most part and for the majority of people, getting the vaccine is safe, it's efficient, and it is the right choice because it is what will get us back to normal. And we all want to go back to normal, but really the vaccine is the best way to get there. So personally, I am so excited and grateful that I am fully vaccinated, that I will have that full immunity in another week. That's just a relief to me to know that it's so the likelihood of me getting COVID, and especially me spreading COVID to other people who may be more affected by it than I would be, that likelihood has dropped down so much. And that just gives me so much reassurance. And I just am excited for it. I do think that this is how, as I said, we will get back to normal, how we protect people. And this is just what needs to happen. And I'm really thankful that in Wyoming it is open to everyone, so I was able to get it. I know in other places there are people who want to get it who are still waiting because of just the system and how the distribution is working. I'm thankful that it's open to us here, that I was able to get it so early on, and just for the opportunities and the reassurance that it gives me. So I just wanted to share just those thoughts with you and tell you about my experience and some of the discussions that I've heard happening related to this. So thank you for taking the time to listen. I hope it was helpful. Again, please do your own research, talk to people who know what they're talking about better than I do, to the scientists who can explain it well. But I do encourage everyone to look into it, but please seriously consider getting the vaccine if you haven't yet, because that's what's going to help us move forward. So thank you for your time and for listening, and keep checking with us for more updates, and I hope everyone has a good day.